In today's video, we are going to discuss about medroxyprogesterone acetate, or what we call Depo medroxyprogesterone acetate, or popularly known as Depo Provera. Now, we are going to look at mechanism of action, its effectiveness, side effects, how frequent you can use this particular drug, and what are the long-term benefits or pros and cons in terms of those who have used this drug for a very long term or very long time. Now, kindly note that mechanism of action, or how this particular drug work to prevent pregnancy, is that it normally thickens the cervical mucus of the uterus, thereby preventing the spermatozoa from reaching or hitting its targets at the fallopian tube, resulting into fertilization. It cuts by thickening the cervical mucus, and again it normally prevents ovulation to take place, so there is no egg that is released for fertilization. And the interesting part of it, it also acts on the endometrium, preventing implantation to take place, thereby there is no development of fetus. When women are using this particular drug, they may experience some slight normal side effect like headache, hot flashes, general body tiredness or general body malaise, loss of appetite, sometimes mild backache. But the most feared or most severe complication of this drug that is coming out prominently in most of our females, or most of our women, is heavy bleeding. Now, when I want to talk about heavy bleeding, is that some of our young ladies or some of our women, when they have started bleeding during their normal menses excessively, they normally stop using this particular drug without even consultation. Now, there are drugs that we normally give to stop this particular bleeding and also to even control your menstrual flow. If you are coming to gynecological obstetrics clinic, we normally prescribe Silate, or we can give you combined oral contraceptives if it has no severe side effect in you. Now, note that before you are injected this drug, you should be able to be attending your menses, and it is documented that in the first 5 days of your menstrual flow, it works effectively, or it works immediately. But when you are not in your menses, we should be able to know your pregnancy status in terms of doing pregnancy tests. And when you have been injected this particular drug, when you are not in your menses, kindly avoid sexual intercourse until 7 days has elapsed. Or you can use barrier method, that is the use of condom. So it is very important to know your pregnancy status before you are injected this particular drug. Now, this particular drug, we normally inject it on the deltoid muscles and in your gluteal muscles, that is in your buttocks, after every 3 months. Now, something that is coming out clearly through most of our women in terms of research is that I have been pregnant while using Depo Provera. What normally happens is that when a woman has been injected this particular drug and she has not kept the time of this drug, I said after every 3 months, if you normally miss injection, then you may become pregnant as soon as possible. So it's very important to keep time to avoid this particular woman to conceive when is using a Depo Provera. Now, common question is that the questions that are coming, one of them is that what will happen if I use this drug over a long period of time? When is my fertility coming? When am I ovulating? Now, those who have used this drug for a period of long time, about 2 years, it's documented that they should be able to sort other methods of family planning or consult, because it is linked to cause low bone density or osteoporosis that may lead to weak bones and even fracture of bones. That's why we normally give supplement for women who are using this drug past 2 years. We normally prescribe calcium and also vitamin D, and also we encourage them to eat a lot of meals that are rich in calcium: fish, kales, vegetables, fruits. Those normally provide high quality in terms of calcium, and this one will maintain their bones, and even supplements we can give for vitamin D. Now, when you have used this drug for a period of time, that is a longer period, your fertility might delay, and your fertility might delay in terms of you may be able to conceive after 3 months of stopping using Depo Provera, up to a maximum period of 2 years. So if 2 years has elapsed while you have stopped using Depo Provera and then you have not conceived, then we may be able to ask ourselves, is this primary infertility or this is secondary infertility? And now, Depo Provera, you should be able to know that it is not linked to permanent infertility. It is not linked to permanent infertility, and when you've used it past 2 years and you have not conceived, then we should be able to evaluate you and look at what are the possible causes of this your secondary infertility. Now, I discussed about infertility in both men and women. Kindly watch the video that appears up here about infertility, and also in the descriptions there are videos about infertility in men and infertility in women and their solutions. Now, if you love this channel, kindly hit the notification bell, return subscribe, turn it on for more videos that we'll post, because common things we normally post them in this particular. If you have any question related to family planning, particularly about the topic we've discussed about medroxyprogesterone acetate or Depo Provera, kindly comment at the comment section and we will be there for you. If there's something that we've left out, kindly add and we will pin it, and we'll appreciate how you have contributed to this particular channel. For those who are supporting us financially, we are very grateful, and we have been receiving your support via the PayBill number and the account number in the description below. Anything that you will support us in this particular channel is very important to us, and we are really thankful, and we are really grateful for your full support. Otherwise, click the notification bell, return subscribe, turn it on, because most of good things about medical issues are coming in the channel. It's when we have opened the channel to all medical videos, and we accept everybody who is willing to subscribe and join us in this particular channel. Otherwise, thank you so much for watching. I'm very grateful, and see you in the next video when we are discussing another method of family planning. Muchas gracias.